thank you so much for downloading our toolkit on how to create your own Reader's Health Theater. You've taken a first great step in helping the members of your organization or community group to improve their well-being. My name is Cheryl Witt, and I'm a nurse, an educator, and a professor, and I've worked with groups who have used this Reader's Health Theater to effectively change their community's health habits and behaviors. Whether you're working with a population of clients, members, students, or families, chances are there is an area where their health or lives could be improved. That's where the Reader's Health Theater comes in. Reader's Theater is a style of theater in which the actors read directly from the script instead of memorizing their lines. They're not professionals, but they may ham it up a bit. It goes back to the war when entertainment was a brief escape from the situation, but resources were scarce, so people focused more on scripts rather than their sets, and they encouraged a follow-up discussion after the show. We designed this toolkit document to help you plan your own Reader's Theater event. This event changes how individuals in groups of all shapes and sizes live their lives because of what they learn and how they learn at this event. It can be adapted to any age group or population. This concept has been used all over the country and resulted from decades of research. It leverages the power of community and peer groups to change behavior and reduce illness and injury or get a message out among vulnerable groups. It's fun and creative and brings new insights. Best of all, it is what you make it. You can serve a 5-course plated dinner or a box of cookies. You can have an elaborate set or minimal props and no design. And the audience can be 12 people or 100. It's totally up to you. Today, I want to go over some of the steps to help you utilize this toolkit as effectively as possible. The toolkit is a large document, but it's important to show you how your own Reader's Theater event can happen. I'm going to go over each step, and you can look in the toolkit for more details about anything that I mentioned in this video. There's a table of contents that can help you to easily find information, and this will help you to best use your time. The results we've seen after theaters have been amazing. People have recognized issues in their own behaviors, and they've changed their health practices. They truly become empowered to make changes. In fact, more than half of the attendees make a significant change to their health and safety habits. This is huge. Whether it's smoking or arthritis or encouraging kids to wear helmets, there is a tremendous benefit to this theater approach. We found that people often don't like to be told what to do by a health professional, teacher, or counselor. And often, many of these professionals can be constricted by time restraints and have minimal conversations with their clients. So these events are a fun way to share the information, and it's information that people can listen to from their own peers. And did I mention again, it was fun? Set up your event for success. First, you must select a committee and develop your goals and purpose with them. What exactly is your message? Pick a committee of 4 to 6 people to plan the event. Get a mix of talents on there. Someone who can write, someone who can organize logistics, and someone who is great at promoting, and someone who can recruit fantastic actors and sponsors. Then you need to talk about what you want to accomplish. Why are you having this event? Is this something to replace another seminar that you usually have at your facility? Do you want to help the older members of your community prevent falls? Do the college students that you work with seem to be stressed? If you don't have a goal or problem in mind to solve, it will be hard to direct your attention. For example, maybe hearing loss is a problem in your community. So your goal might be to help adults conserve their hearing. You'll identify your audience as middle-aged and younger adults, and your aims will be to help them understand how hearing loss happens, how to reduce noise levels, and how to increase their use of hearing protection. The why would be that too many adults have hearing loss in your community. I have a few checklists for you to utilize in the toolkit. Make sure you have regular meetings with your committee, though, to keep on track. You'll want to plan the logistics of the event at least 4 months in advance. What is a good date for your event? Will it be a standalone event or part of a regular meeting? Where will you have it and what are the features of that space? It is important to consider the acoustics of the room, the refreshments served, and the nature of the food. Is it a catered meal or snack? Is the menu appropriate? Also, if the community members you want to attend have young children, childcare may be necessary. And there are usually some policies regarding that situation, so check into that. How many people will attend? We recommend at least 40, but no more than 100. But it certainly depends on your specific group. The venue is really important. Community centers, clubs, places of worship, auditoriums at schools, country clubs, as long as they're easy for your audience to find. You want the parking to be easy and the sound to be good. I have some tips in the toolkit about some different types of microphones to use. If you need a microphone, I recommend a wireless microphone over the one that you pass around. Next, you want to plan the participants of the theater, the actors. The most important quality in the actors really is their level of sincerity. If they treat the topic as a joke, the audience will too. They'll need to do at least one rehearsal, more depending on how elaborate your event is. Get a couple of understudies if possible too, just in case something comes up. You will also need someone, a doctor or nurse or other public health professional in the community, to be the facilitator at the end of the show to guide discussion and answer any questions. This also provides credibility to the event. I have some great tips in this toolkit to help guide the actors. They should be familiar with the script, but the great part is they don't have to memorize anything. From experience, I recommend that actors show up 1 hour before the event starts. There are a lot of competing events for people's time. You want people to attend the event, so it will need some promotion. You'll need to identify your target audience early and position the event appropriately so it appeals to them. Some events require tickets or online reservations, and those are great to have. Some examples are like Sign Up Genius or even just an online spreadsheet to track your attendees. Touting the event as a night out sometimes works with couples, or it could be an ice cream social. Make sure that other people at your organization also know about the event, just in case someone reaches out and asks for information. Sponsors may be helpful to fund your event. Local retailers or services could assist you, as well as local healthcare and wellness providers, cities, or schools and community groups. Make sure any giveaways or messaging from them is appropriate given your goals and script content. For instance, you don't want to talk about diabetes prevention and have a candy company be a sponsor. At any rate, make sure you recognize all volunteers and sponsors who have helped with the event. Advertising your event is very important, and you'll probably need to use social media. Make sure you share the time, date, location, registration information, and deadlines. Facebook, or whatever the hot social media of the moment is, can be used depending on your audience. Good old emails or postcards work too, or even a blurb in the monthly newsletter or e-blast. Ensure that your committee members and actors engage with the recruitment, social media, and other marketing materials. We have some sample flyers in our appendix in the toolkit, which I recommend looking at. The actual performance content is really important for the theater. Now we'll talk about the sets and scripts. First, you'll need to have a set or at least some props. For example, if there are foods you are trying to convince people that they should eat instead of fried food at your event in order to promote heart-healthy diets, display those foods. Maybe even serve some for dinner. Make sure the set is easy to move, rearrange, and have it in place 2 hours before the event. The scripts are pretty important because these are what will engage the participants with your topic at hand. We have several scripts for you to review and adapt as appropriate to your audience. Definitely change the names to those members of your community or actors. They do not have to be professionally written scripts. However, you should definitely have them at least reviewed by your committee and ideally some potential audience members. And you will need to make sure that they are culturally relevant and avoid stereotypes or anything potentially inappropriate or offensive. The scripts will present a situation, show a character recognizing the issue eventually, and then offer resolution to the situation or potential solutions. These scripts can be humorous and poke fun at actors, or stay serious to demonstrate the gravity of the situation. Don't worry about grammar and definitely use local language. Ultimately, what we want to do is really at the end of the show have groups of people engage with the content and think about actionable ways that they can improve their health behaviors and mindsets. You may also want to leverage the backgrounds or popularity of the actors. Describe their backgrounds and ensure that the audience know that these are not professionals. These are peers who face similar issues just like them. Handouts are important to have depending on the audience. If it is a useful infographic, people are less likely to throw out that than a pamphlet that doesn't really link them to resources. Maybe even do an accompanying social media post with the infographic. We have some sample infographics in our appendix in the toolkit, and you can look on the CDC and other reputable websites for handouts on nearly every health issue possible. Look for the Health Topic Information Resources section in the appendix. Like I said, the after talk and the discussion is what's really important because that is really where the magic happens and people start to apply the situations to themselves and think about making changes along with their peers. This discussion, led by a health facilitator, really turns the event from a passive learning environment to an active one. We offer some strategies to really engage the participants, and our appendix also shares some questions after many of the scripts for follow-up discussions. Ask open-ended questions like, what just happened here? Or have you been in this situation or one like it? How did you handle it? What character do you most identify with? You could also informally poll the audience for a show of hands. Get people into small groups to talk about things and have someone report to the bigger group later. This is an effective learning strategy. Discussions don't have to be long. Our average was only 10 minutes. If you think the audience might not be very talkative, you could consider a plant in the audience. Finally, evaluations are really important to understand the impact that your event had. These can be the reason that you have the next event or explain how situations have changed in your population. I would love to hear from anyone who has done an event, and we are also happy to help you plan and evaluate it. Giveaways are one thing that keep a crowd going at the end. Whether you do a drawing for a door prize or have a little gift from the sponsor to everyone, these are good ways to encourage attendance and participation. So my biggest tip to you is just to have fun. I want to thank you again for downloading our toolkit about Readers Health Theater. I'm excited for your community to utilize this concept to improve their well-being. This really is something that leads to information sharing and will empower people to make decisions and change their lives. Break a leg? Not really.